All right, everyone, thank you so much for being here. Let's get started for real. We are here for our Prevention Peer Network, our monthly webinar. This one is on food insecurity and intimate partner violence. All right, so just as a reminder for everyone, if you can keep yourselves muted when you aren't speaking, just because sometimes we have background noise, myself included. I would love to see your wonderful faces, but this is a judgment-free zone. So if you want to keep your camera off, you're more than welcome to. Closed captioning is enabled, and I am going to ask for some participation. There is a little bit more lecture in this webinar, but I'm going to pose some questions, ask if anyone's heard of some things, and I really would love to see any participation. So feel free to come off mute, to raise your hand, or to put in the chat if you have any questions, any thoughts. I've also just been in webinars too where people will use the reactions and do hearts and 100% things when they like something, and that would also be really welcome here as well. Okay, there seems to be a small delay from when I click to when the slide actually goes. So I'm going to start with a land acknowledgement, and I am going to put this link in the chat so that everyone can access and learn about whose native lands they are on. There also is a text line in case people prefer to use that. So the standard one that we use at the partnership is we acknowledge that we are on the traditional territory and homelands of California Native peoples. These nations include over 120 federally recognized tribes and many other non-recognized tribes that are all very culturally diverse. We thank these nations for their generosity, and we keep them in our hearts and thoughts as we are in this space today, this week, and every day. And so something also that we're trying to do at the partnership is not just do the land acknowledgement, but really learn about the history of the people. And so I am going to just share. So I am actually on Nipmuc, Agawam, Massachusetts, and Pawtucket land. For those of you that don't know me, I'll fully introduce myself in a minute. But I am one of the East Coast workers that work for the California Partnership to End Domestic Violence, which is unusual. But we've been doing this for several years now, and I love working here. And so I am going to, since I just listed 4 tribes, I'm going to just talk about one. I'm just going to try to talk about a different one each time we do one of these. So the first one I listed was the Nipmuc. The Nipmuc are in Central Mass, Northeast Connecticut, and some of Rhode Island as well. They're about 600 members, and is one of the most historic tribes in New England. It also, unfortunately, because of our history of colonialization, at 600 members, it's one of the largest tribes, which just shows the devastation that came to this land when the English came over. So that is some unfortunateness about that. Also, it is a recognized tribe in Massachusetts, but they are not a federally recognized tribe, which I find very interesting as well. So that's why not as many people know about the Nipmuc, but they are whose stolen lands that I am on. And I encourage you to learn about your lands as well. All right. So it would be great to have an idea of who is in the room with us. So if you can type your name, your pronouns, your role, your agency, and your location, which you can now include your native lands because of that link, that would be great because I see some names I recognize. I also see some names I don't recognize, which is really exciting. I love having new folks in, and I love my regulars too. So I'll give everyone a minute to do that. But while you're doing that, I'm going to formally introduce myself. So I am Kimmy Remus, she, her pronouns. I am a prevention specialist here at the partnership. Up on the screen are my lovely team. They are not here today because of a conflicting priority. So we're kind of covering down on multiple projects at the moment, as I'm sure, some people are familiar with that concept. But this is my team, in case anyone is ever interested in contacting any of us. Okay, so we have, okay, prevention team, case manager, another case manager. Okay, case managers, victim advocate, community advocate. Great, 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 great. So I'm seeing some folks with a lot of overlap. That's wonderful. Spread out throughout the state. Ooh, these are coming in like really fast now. This is great. I appreciate you all introducing yourselves. Um, oh, okay, fabulous. School-based coordinator. Amazing. All right, thank you for doing that. Folks can continue to introduce yourself in the chat. And it's great to see who we have. All right, so we're going to start off with some definitions for today's topic. Now, has anyone heard of any of these terms before? Anyone want to share what they think a definition is or how they've heard of any of these terms? You can come off mute, go in the chat, raise your hand. That's okay. That was the first question I threw at you. So maybe folks are just, a little quiet to start. We'll get you talking at some
So
point. Oh, yes, go
I'll
ahead.
try to I'll try to jump in. So food insecurity, to the best of my knowledge, is a term used to describe the part of the population that maybe isn't super secure in knowing where their next meals are going to come from. It's not as reliable and they're at risk of poor food access. And for food desert, that's a term to describe like maybe they're in an area that doesn't have a lot of availability of like fresh food that's within like a walkable or easily accessible distance to them, like people in more rural areas or people who only have like a couple grocery stores that are like limited near them.
Awesome, Talia. That was fantastic. And also, I appreciate in the chat some folks sharing that they haven't heard of food swamp or food mirage. So yeah, so you basically kind of hit the nail on the head of what food insecurity and food deserts are. So food insecurity is when people don't have enough to eat, or as you said, they don't know where their next meal is coming from. Um, a food desert, as you said, are people who have limited access to healthy and affordable foods. So another example of that, you did mention about people who might have to travel farther. So that's an example. And also, if you think about certain areas where there is maybe a more concentration of like dollar stores than grocery stores. There are a lot of things that dollar stores are great for. I love the dollar store for lots of things. But the food options there, as we know, are all very shelf stable, which is helpful in some ways, but they are usually heavily processed, not particularly healthy. Food swamps. So some of these terms were I'd heard of them, but food swamp being one of them, food mirage, I had not. So this was very interesting for me when I was delving more into this topic. A food swamp is a region that has maybe adequate access to healthy and affordable food, but they also have an overabundance of less healthy options. So if you think about, let's say you go in a grocery store, right, you have a normal supermarket. It's affordable in theory. I mean, food's really expensive these days. Um, but okay, there's a supermarket, it's affordable, there are a lot of options, but let's say you're looking at a shelf of cereal or like a wall of cereal, and you know, three of the four rows are of sugary, processed, unhealthy stuff. In the very bottom row, there are like three healthy cereals that have like a low sugar content or something like that. It's more often that people will go for the ones that are at eye level, the ones that where there are more options for. It's just more likely because there are more of them. And then a food mirage is an area where people live close to a grocery store, but they're not affordable. So because that they either have to travel further for healthy foods within their budget, or they end up, paying more than they can afford, or they buy some of the unhealthy foods because that is what they can afford. So, for example, maybe it's great that someone lives right next to a Whole Foods. But another joke about Whole Foods I've heard before is Whole Foods, whole paycheck. So that might not be feasible for some folks. And it's like, okay, well, that might be a nice treat every now and then, but I still need to travel much farther to go to a Safeway. And then I think a lot of folks here might know what intimate partner violence is because from what I was seeing, people are shelter advocates, they're prevention specialists in the chat, you work in this field. But if anyone's also watching the recording, intimate partner violence is a pattern of repeated behavior in a relationship to gain or maintain power and control over a partner. It's a very general definition. There are many types of intimate partner violence, economic, physical, psychological, I could go on. But power and control tends to be the main theme. And so now that we've gone over some of these definitions, can anyone share if the areas that they work in or where they live, if they don't mind, if they fit either kind of a desert, swamp, or mirage uh, definition? You can just put in the chat. You also might be in none of those. You might have the like wonderful, oh, okay, like yes, I have a regular supermarket and it's fine. I am probably in, I'm mostly fine, but I probably live a little bit in a food swamp because I do have a supermarket that's 4 minutes from me. But they do seem to have an overabundance of really unhealthy options, and you kind of have to search a little bit harder for the healthy options. Also, I have in the chat, thank you, Shirley. I think being in downtown LA, it could be between food swamp and food mirage. Yeah, especially in like those cities where Trisha said the same. Sometimes it's neighborhood to neighborhood. Food mirage for Sacramento, I'm seeing. Food desert, Angela says, in Bakersfield and Kern. A lot of areas that are food swamp and food mirage, some rural areas food desert. Yeah, it really depends, doesn't it? So it can be kind of a number of these terms depending on your location, even within the same area. Um, so I appreciate, yeah, I'm seeing Food Mirage in San Jose. Oh yes, I've been to San Jose. I agree with that. You see San Diego, Food Swamp and Food Mirage. I know it's really interesting to see kind of that a lot of them are like dual together. Food Mirage in Irvine. Yeah. A lot of those health food stores, but none of them are really affordable. Exactly. Um, So thank you all for sharing. And does anyone, we're jumping ahead a little bit, but think they might know why some of these areas exist? Like why there might be a food desert or a food swamp or a food mirage somewhere?
I mean, I think it all comes down to like the economics of it. So like for me, like in Irvine, I work in Irvine, but I live closer to like LA County. So I'm in LA County, but I work in OC County. So I feel like looking at the difference between where I live and where Irvine or how Irvine is, it's a lot more of those uppity food markets compared to here where it's a lot of like the dollar stores and like the, 99 cent and stuff like this. So I think it all comes down to the economics and the class. Um, and that's yeah.
Thank you so much, Alyssa. And I see also Erica put in the chat as well, changes in the economy. Yeah, so depending on where, and a lot of that we know is structural, right? A lot of that we know are certain areas by choice of developers and based on the economics and who live there. They will maybe put more of those types of stores. Yes, Erica sees where I'm going. Systems that are in place for power and control as well. Absolutely. And then, you know what, since I put at the bottom here, intimate partner violence, do we think food is related even to intimate partner violence? Or am I just putting too large? Yes, I got a resounding yes in the chat. Yes. Yes.
I think it's related in a lot of ways. I think intimate partner violence and domestic violence as a whole is much more complicated than I think some service providers or the public at large think it is. And so I think one of the ways I can think of with clients I've worked with, right, is like if they're controlling, they want their partner to be skinnier, right? Or they want them to look a certain way. So they're going to control the amount of carbs they're intaking. Or anytime the partner is eating like candy or something that's like bad, the partner like shames them for it. Like those are some examples. I know there's so many other, but those are some ones I can think of.
I appreciate it. Yeah, so power and control in terms of kind of that psychological aspect. Um, Definitely thinking about economics. We know that economics have a lot to do with intimate partner violence. And then I see in the chat a question. Yes, absolutely. So there is an actual definition for these. I will bring those up. Actually, I'll just put in the chat the link, and it is based on distance. There is a really cool tool that I think I actually opted for a different tool when doing this, of which one I wanted to use, but I'm going to put the definition link in the chat. And for those of you who are watching, this will be in the resources tab, so this will also have the links on it. And I believe there is, I can bring it up. Those are where I got the definitions from. And then there is, where's that cool map? Yeah, I love when folks do this because that means I can really kind of go into it more. I'll have to maybe look for it and follow up because I'm going to a more California specific map in a second. But there is a map through the US government where it says like also the definitions of like, I think it's within 10 miles is determining if like that's good access or not. And then there also is another layer on the map that you can put about car access because not every, it's fine that it's 10 miles, but 10 miles to walk versus 10 miles to drive versus 10 miles, those are very different things. 10 miles, but you have to switch a bus because one goes in the opposite direction. And then, yes, economic control I see in the chat, financial abuse and whether, yes, it being restricted and isolation puts a real part into that too. Awesome. Thank you all so much. So this was the map that I'm going to use. This is from Feeding America. And as you can see, our map of California, I'll move the chat out of the way. So the darker parts are the more food insecure. We see this little corner down here, but a lot of far north and Central Valley. But this is LA County, this one right here. And when you go on this map, which I will put in the chat as well, if you go on this in your own time and play around, you can click on these dots and it will tell you about like, okay, a city like SF on this dot. Or can people actually see where my mouse is on the screen when I point to it? Or is that something only I can see?
We can see it.
Okay, thank you. Because I realized if I'm pointing out stuff and you can't see where my mouse is, then that's not helpful. And so in California, and this is from 2022, so that's unfortunately how data kind of works, where, we assume some point in this year, 2024, we will get the 2023 data. So we're a little bit behind, but about 5 million people were considered food insecure. So they didn't either have enough to eat or they didn't know where their next meal was coming from. And so that's about a little over 12% of the state population. Now, if you go to certain areas, like LA, which we do focus on LA County sometimes because, as we know, it's quite large. It's larger than most states in the United States in terms of population. 71% of those households qualify. They are what's called below the SNAP threshold. And SNAP we will talk about in a bit, but that is a governmental assistance food program. So that just kind of shows, things can really change based on where you are located. I mean, even saying LA County is huge, what's going to be true, downtown is going to be different versus Hollywood Hills, which is going to be different versus, I mean, like, that's really still talking about a lot, but you can kind of see where things might go here and there. Now, there it goes. Another little piece of data I'm going to share is, so the California Black Women's Collective Empowerment Institute did their first ever quality of life survey. It goes through a lot of different aspects, but some of the things that stood out to me were 4 and 5 were having trouble with inflation. And so even I'm thinking about those 2022 numbers and wondering how much that's increased, because I don't know about you, but like my groceries have increased in price in the last week, let alone in the last 2 years. Yes, I'm seeing a head nod. The grocery stores don't think I noticed. I noticed eggs went up 65 cents. That adds up. And so I'm sure it's even more now. 31%, so almost a third, said that they struggled with having enough to eat. Oh, enough. Oops. Human, it happens. So enough to eat. I'll have to change that. And then 80% said that it was extremely important to have to expand this access to affordable, fresh, and healthy foods. And so another reason why I'm bringing up this survey in particular is because when I was kind of asking about why do we think this is in certain areas, we know whenever there is inequality that people of marginalized populations will feel the impacts more. Black women in the US tend to historically and currently be some of the most marginalized, systematically oppressed. Of course, there are other populations that are too, California has a very large undocumented population. We're thinking about people with disabilities who might just have SSI as their income. Their non-English speakers might have difficulty accessing foods, the queer population. So just kind of to keep in mind all those things. And when we're talking about like food deserts and food swamps, a lot of that is structural racism or structural classism, because they are putting the oversaturations of McDonald's, dollar stores in poor areas. Or if we think about, if you are working multiple jobs, minimum wage jobs, you don't necessarily have time to cook like a roast chicken at home. So you're more likely to go get a fast food meal. And that's very real and understandable, but those are some of the larger societal impacts. Okay. So here was an interesting chart that I came across recently. Even though this actually just came out in an article, it is from, oh gosh. It is from a little over 10 years ago, but a lot of it is still relevant. You can see some of the reasons, the things that happened right before people got on governmental assistance food programs. So in California, it's CalFresh. It can be known as food stamps in other places, EBT, SNAP. So newly separated or divorced, new infant or dependent, decrease in income. A lot of this is decrease in income. Unemployed can be part of income. And so if we think about it, there are so many folks where just something, an unexpected car repair, an unexpected, trip to the emergency room, any of these things can set someone off to the needing extra assistance and not having enough money to buy food for them and their families. I'm going to start drawing a little more connections to intimate partner violence. Can anyone think of, even just using these examples here, how they might be related to intimate partner violence? And of course, I just want to say, obviously not saying that everyone who is food insecure is going to deal with intimate partner violence. But we know that these are components that can add to a situation that's maybe already a stressful environment.
It could be that they were forced to give up their job or, kind of bullied out of their job by their partner. So now there's a loss of income as well.
Absolutely. Thank you, Carla. So yeah, so that power and control. Yeah, Alyssa, go ahead.
Yeah, I was just gonna say like if a I actually our organization has been focusing on this a lot in regards to like parents who are taking care of their kids during the summer break. And really how those who are being sorry, I'm having like a brain fart. Those who are perpetrators or abusers, they might either force their partner to stay home with the children. So then that's also the loss of income for them. Although they might not lose their job necessarily, it's still a loss of income and it's being affected in the workplace. So I say that also.
I really appreciate you bringing that up because definitely caregiver discrimination occurs. And so, that is an agenda priority of, for example, the California Work and Family Coalition that we work really closely with to advocate for ending caregiver discrimination because we know it impacts these things. Anything else? Loss of income. I'm reading from the chat for those that are watching later. It can also make it harder for someone to leave a person who harmed when they are trying to build up enough funds to leave and be independent. Absolutely. Absolutely. These are all really great points that you're bringing up. And so I'm also going to just share a partnership resource that we have. It's in both English and Spanish that we made in conjunction with the California Work and Family Coalition, but our paid family leave toolkit. So our paid family leave toolkit, because we know that that's really important that folks know about safe and sick days. And when they have, for example, new infant or dependent of the family was 4% of this pie chart. So, it's significant enough. That it's taking time off of work, or some people go back to work sooner because they can't afford to. So building that economic security and these toolkits really help folks, work on that economic stability with people that they work with and making sure that they know their rights. A lot of our job as preventionists is allowing people to know what their rights are, and helping them advocate for that. And so CalFresh, which I mentioned before, is a benefit program, also known as SNAP, food stamps, etc., that allows an eligible person to have some supplemental income in order to buy food. And so there are, a couple of requirements. You need to have a current bank balance of under $2,001 or a balance of under $3,001, but share your household with either a person who is 60 or over, or someone with a disability. So, that means a lot of people are probably eligible because, living paycheck to paycheck, you don't have $2,000, $3,000 hanging in the bank. Or as we said, okay, that unexpected car repair, that, might just dip you down a little bit. That loss of income, okay, going on leave and not knowing how to apply for paid family leave benefits, or staying home over the summer with the kid. A lot of that is also kind of rooted in traditional gender roles, right? So those are all things. Now, one of the other hard things, though, about CalFresh is that you need to have an interview, and you have to provide a lot of documents. Proof of identity, so like a driver's license, a social security number, pay stubs, if you've been employed, bank statements. And how difficult is that for some people to have all of those documents at their disposal, right? It can be really hard to have that. If you are, let's say, paid in cash, if you don't have a bank account, if you are undocumented, right? There's so many things. You are able to get CalFresh benefits, I believe, even if you are undocumented. But, a lot of folks we know are nervous about interacting with state entities because they are afraid that they will then get reported to ICE or something like that. Oh, Talia put little alone time or ability to gather it, even if you have access to said items. Exactly. So there are a lot of barriers to getting these things, right? This takes time. All right. So we talk a lot in prevention about risk and protective factors. And so kind of going about what I said before is that, not everyone who's food insecure, that's not true. And there are wealthy families that have, more food than you can imagine who have intimate partner violence as well. It does not, it touches everyone. But we have these things called risk and protective factors that increase or decrease the likelihood of perpetration or victimization based on what your life stressors are, based on what your community and societal stressors are. And so there we go. So can folks, we've been kind of talking about all these things, but, thinking about preventing intimate partner violence, we talk about, what's modifiable. We want to increase our protective factors and we want to decrease our risk factors. That's a lot of what we do in prevention. So, there's some questions on the screen. What characteristics, environmental factors, etc., might increase someone's risk factors or increase protective factors? Okay, I see lack of access for disabled people, lack of accommodation for non-English speakers. Absolutely. Absolutely. Those are huge risk factors for barriers of getting services, to be able to build your economic stability, to have enough food to eat. Because we really see economic stability as a major pillar of our work in prevention for some of the reasons that folks had said before. Any others? Lack of knowledge of education about local programs and services. Yes. It's also really hard to change a lot of your circumstances, right? If you live in a food desert, you can't just pick up and move to an area that's not a food desert, right? It's really hard. So that's another reason why we need prevention, because we need to enact on these larger community items as well, right? Because some people can increase their knowledge, absolutely, can access services that maybe help, if they're a non-English speaker, or there's some fantastic organizations like Deaf Safe in NorCal that helps deaf and hard of hearing folks access. So like there are these options, but that's why we're here, right? Okay, let's go to the next slide. So Alyssa also mentioned earlier a little bit about, kind of like, oh, maybe, someone is asked to stay home with kids. That tends to be, a very, as you could see on bullet 4, gender roles are something that, even though we know gender roles are socially prescribed norms, that we also try to change our prevention, right? When we do our education with youth, we try to, change some of those societal norms and knowledge and attitudes and behaviors. That's a lot of what we do. But there is kind of the idea of, all right, if you are female identifying, you are responsible for feeding the family. You're responsible for taking care of the family, right? I'll get personal for a second. I am a breastfeeding mom. And so my spouse would really, like to take part more, but physically I'm the only one that can do this part. So, maybe that means, they help out in other ways, or, like clean some of the bottles and pump supplies for me. Like there are other ways that we can make it more equitable, but at the end of the day, like that for this time period is on me. And I've also agreed to do that and have decided that's something I want to do. And it's been my full, within my full control to start and stop, whenever I want. But there are just some real logistics of that, right? I haven't talked about WIC really, but that is another government assistance program from that will help give supplemental for pregnant people, for breastfeeding people, chest feeding people, lactating infants, that sort of thing, to just help in kind of that early healthy start. But also that's a little discriminatory in itself, right? Because it's WIC, I believe, stands for Women, Infants, and Children. But for starters, we know that there are more than 2 genders. And also sometimes there are men who are in primary caregiving duties, does not really think about queer families. So it is not always easy because of how society is structured for folks to get that. Now, I've listed a couple of other increased, risk factors. Does anyone mind, because I've been talking for a bit, saying, how they think some of these other things might contribute to intimate partner violence?
For me, when I was going over the list, I'm making a note so I can talk to my supervisor about it. But the last one, rates of violence increase after a disaster. So I, of course, was thinking of environmental, but I think when I saw it, I immediately thought of like, if an abuser lost someone, a loved one, let's say, where it's like a disaster where they're gonna grieve another person, that might lead to an increase in violence in their relationship. So I immediately was just like, well, I think we need to address it a bit more. So now I have like brainstorming ideas. So yeah.
Thank you for sharing. And I love that this is generating something for you. I hope it is for other folks too. But yeah, disaster can mean multiple things. It can be on a large scale or just a personal scale, right? So that is an increase as well. And also, I will share upcoming events in the chat later, but we are doing a call on natural disasters tomorrow, just as an FYI. So that was originally what I was thinking, but you're right. Also, like if there is a personal disaster, or think if the person who causes harm is the one that loses their income, how do you think they're going to react to that? If they are, deem themselves as the breadwinner or something like that. Any of the other ones that folks want to talk about? So, the first one is all about power and control, which we talk about a lot. So climate change is another, and that also is just to like the ability of how much food there is. The climate change is impacting crops every year. We're now told that we need to worry about bird flu impacting our dairy and meat down the line. And so there's a lot that climate change is doing to also make the food supply smaller. And then interrupted transportation and food safety. So, okay. COVID's especially devastating in regards to IPV, no reprieve, close contact for families with abusive partners. Yes, thank you, Talia. So that definitely, like when it was acute lockdown time, was incredibly, I know that, our organizations were trying to figure out immediately like what we could do to help because it was such a devastating time. We are in another surge currently. And so thinking back to our paid leave and safe and sick days, this is all connected. I believe food and restaurant workers are one of the most impacted by the COVID pandemic than other industries, and other low wage workers because they can't afford to take time off of work and isolate, and to get themselves better. And therefore, they're also more likely to get long COVID. And so, again, we're seeing those structural things happen where who tends to be in our society more low wage workers. We're looking at people of color who have the highest rates of morbidity and mortality from this. So this is all very connected. And then interrupted transportation and food safety. So thinking about, okay, that car repair, okay, you used to have a car, now you don't. You're solely dependent on your partner for transportation, or you are that person that you have to travel further for food. So you're taking two buses, and a bus breaks down. Like there could be multiple reasons why it just anything like that can trip you up, right? Now, it was also mentioned about summertime. Summertime is a really hard time for folks that are food insecure, right? A lot of families rely on school lunch and breakfast programs or after school snacks at like Boys and Girls Club or YMCA or community center. A lot of those programs aren't running in the summer. I will say there is a new program. I believe it's new this year. It's called Sunbucks, and anyone who's already enrolled in CalFresh would automatically get enrolled if they have a school-age child. And it will provide $120 per child. So that way those families can get a little bit more to eat. But also, just as a side note, I don't know if anyone's tried to feed school-age kids, but one time I was buying snacks for my niece and nephew, and like they went through those snacks in 5 seconds. Like it is hard. That's not necessarily enough. Right? So there are but a lot of folks might not know about Sunbucks just because it is so new. So making sure that they are aware. Now there is both an application for your phone and a website, which I'm going to put in the chat. So that will let you know or let folks know where they can locate summer meals as well. Like I know my library provides meals for families just for lunch, and it's like 2 days a week, but that's helpful, right? So we're starting to look at some of these other things that are factors. Also, we're thinking about, it's been a heat wave, y'all. And so we were just talking about climate. Maybe it's not being necessarily related to the food, but it is adding another stressor to, I know, a lot of people's summers. And that's another thing too, when I said about going back about interrupted food safety. So you need to keep something in the fridge, right? Because otherwise they spoil. All right, well, if you have a power outage in the summer, or if you are told, that you need to turn off your power, like there are those staggered blackouts for energy conservation. Well, what's that going to do to the food that you have? So there are a lot of things structurally right now. Before I move on, does anyone have any thoughts, questions about any of this that they would like to share or ask?
I just wanted to share where I live in Bakersfield.
Mhm.
We have a lot of different food resources or banks, but one of the big ones is Gleaners. And like probably maybe a month or two ago, like they were in a food shortage. So it was really stressful because not only does my agency, but a lot of local agencies here, they use them because it's fresh food.
Mhm.
And so that itself, increased this stuff. And then we were going into summer when it was starting, because that was like in May when that happened. And so it just helped, clients were like really under a lot of stress because we could get them dry food boxes, but then they couldn't afford to get meat or veggies or things like that. And so like these other programs are so great to know about.
Thank you so much for sharing. Yeah, we work with a lot of different agencies and we kind of create this community chain of all, helping each other and being there for support. And if one of the links in the chain falls loose, it has a ripple effect, we know. All right, so I'm going to switch my screen share because I figured that folks are going to be a little sick of me talking at some point. So we're going to watch this news clip. All right, so everyone should be seeing a like new at 10 news-ish sort of thing. Thank you. Love the thumbs up, Erica. That's helpful. Sound. And I did put closed captioning on. So if closed captioning doesn't come on immediately, folks, I apologize and I will try and figure it out.
San Francisco's Bayview neighborhood, where customers can fill up those carts without paying for anything.
Yeah, it is the first of its kind in the city, meant to help low-income families who live in a food desert. KTVU's Betty Yu checked it out today. She joins us now here in studio with what it's like.
Julie and Mike, so this looked very much like a scaled-down market, but loaded with fresh food and nutritious food at that. Now, different from a food pantry, people don't have to line up for prepackaged items. Customers here were able to shop for what they wanted for free. More than 70 families loaded up their grocery carts at the District 10 Community Market in the Bayview Wednesday, and they checked out without opening their wallets.
So she's saying that she likes being able to pick what she knows that her family is going to eat.
Speaking through an interpreter, Prisciliana Lopez shopped for her family of 4. She says what she takes home today would probably cost her $200 to $300 at a grocery store and last about 2 weeks.
Her husband does work. She says, but the money, it's barely enough to pay for the rent. And, like stuff like soap.
And we have chicken drumsticks, family size.
The neighborhood lacks access to healthy foods, which is why it was chosen for the pilot project. The San Francisco Human Services Agency partnered with Bayview Senior Services to operate the market. Most of the food is supplied by partner stores and agencies like the San Francisco Food Bank and Lucky Bayview.
I really hope people get that this is the way to give out food with dignity and that people have choice. And just because you're low income doesn't mean you just get anything.
Community members must meet certain criteria to shop here, including live in certain zip codes, receive public assistance, have children, and be referred by a community organization.
This card like Costco. So we asked, do you have your District 10 market card?
Shoppers must have a grocery card from one of the market's partnering nonprofits to enter. There are limits on quantities of food. 2 years ago, Supervisor Asha Safai introduced the legislation to open such a market in high-need neighborhoods. Since then, the city has seen many stores like Walgreens and CVS close due to rampant theft.
The majority of the smash and grabs that we've seen have been over-the-counter drugs, over-the-counter medicine. If there's meat, week, you know, I think it's secured in a different way and that they work with the folks. And if that's something that happened, you know, obviously we'll put some additional resources into protecting it.
Safai went on to say it's the goodwill of the people in this community that is allowing it to be a safe space and operation. Now, right now, this market is open Wednesdays and Fridays. Next month, the store hopes to increase that to 3 days a week, and it wants to double the number of customers it serves to at least 1,000 by the end of the year. Mike and Julie.
It's great to see those doors open, but saying that, look, they can fill the carts. They don't have to pay. I'm curious, how often can they actually get to go?
Well, right now they're saying once a month per customer, per household, that is.
Got it.
They hope as they scale up, it can be 2 times a month and then hopefully more.
People that really can use the help. All right, Betty, thank you.
Thanks, Betty.
All right, I'm going to try to bring back, oh, there we go. I'm going to try to bring back PowerPoint. Okay. So, any reactions to that clip? Wish you had one here. Well, hey, you know what? Can always advocate for one, see who the partners are. We'll get to some strategies for prevention in a little bit. Appreciate the dignity aspect. Absolutely. I mean, I've read a couple of things about when you give to like a food pantry or something, what to give. And it's like, you know, people, don't want your can of soup that's, expires in a month. People don't want, or I've seen, canned goods are great, but they aren't going to be any help if you don't have a can opener. It's nice though for folks to like be able to shop for themselves, right? People who maybe don't have a lot of choice in their life, they get to do that. They aren't just handed a bag and go, here, this is what you're getting. So I really love that aspect of it too. I'm a social worker by trade, and dignity and respect of individuals is one of the core social work ethics and values. And so I really love that aspect too. Awesome. Thanks for responding, folks. So we're starting to see kind of some things like this pop up. Sunbucks was new this year. There's this grocery store. There are some strategies that are being implemented in order to mitigate food insecurity, the cost of living increases. And a lot of these things are being done at state and local levels, right? These are some of those societal and community impacts that we were talking about. Does anyone want to read this quote? If not, I can. But I'll wait.
In the margins, they found freedom in their proximity to nature and to each other, creating and living by alternative logics from those that conceptualized them only as workers.
Thank you so much, Talia. So that I found as such a powerful quote. And it is in response to Hurricane Maria that happened in Puerto Rico in 2017. And I have to say, the Caribbean still sees so many impacts from the hurricanes that occur, from the earthquakes that occur, years and years after. And so Dr. Hilda is an anthropologist and a decolonial scholar, and she is talking about how when Hurricane Maria happened, they went back to some traditional foodways of what they did as Native and Indigenous people before colonialization and capitalism. And I think that is very powerful because we talk about, making things work in current systems. That's why we do, advocating for, right, we need Sunbucks now. That is why we try and partner with organizations. Let's create the grocery store. But I also really love this idea of dismantling or what doesn't work within these systems, because these systems that we live in do not work for most people. Preventionists, we talk about systems theory a lot. And so I think that this is a very powerful point of allowing communities to work it together and to work with what they know with their indigenous and native roots, and maybe go outside the lines of our current systems and our current society. And these are skills, like that concept of there's no such thing as an unskilled worker, because unskilled worker terminology is used to justify poverty wages. So, typically in this country, we'll see these folks, immigrants as well as, okay, only as workers, but they have the skills of, doing a lot of that farm labor, for example, that other folks might not do, to be able to get food for their own communities. So thinking about ways that we can dismantle more of the current system and how we can work with the earth and work with what are more traditional foodways is such a beautiful idea that I really wanted to bring into this discussion as well. Does anyone know of any examples of this happening aside from Puerto Rico in the wake of Hurricane Maria? Does anyone work with Native or Indigenous folks where they are? And also, there might be Native Indigenous people on this call, of course, too, who are preventionists. Okay. Some food for thought, pun very much intended on that. All right. Here's another program, Farm to Fork, which is an interesting concept. So Farm to Fork policies and programs, they've been kind of piloted, wow, around, I think the one that's been evaluated the best was in North Carolina, I believe. And they make it easier for people and institutions to purchase produce from local farmers, by making that makes the food more accessible and affordable, but also it promotes the local business and buying from local farmers. And it really has kind of these pillars of agriculture, so preserving the lands and enriching the lands, economic development, so supporting kind of the local food economy, education. This one is about making sure that the youth have enough to eat. Again, we talked about the importance of school lunch and kids getting fed. And the issues of not having enough food to eat. You can't learn if you don't have enough to eat. You can't think. It's Maslow's hierarchy of needs. If your basic needs aren't met, you can't do the other things. And it's estimated about 19 to 50% of caloric intake by children occurs while they're at school. But that also means there's another like 50 to potentially, gosh, I could not do math for a second, 30%, 31%, that they intake at home. And then disaster preparedness. So I was talking originally more about natural disasters. We've talked about climate, but I also like Alyssa's point about, personal disasters. How many times has someone, known or yourself even had a tragedy and people brought you food, set up a food chain, a meal chain? That's one of the first things that, I've been a part of whenever someone gets diagnosed with cancer or loses a loved one. It's signing up for, all right, Thursday night, I'm gonna bring lasagna. Friday night, so-and-so's mom's gonna bring a roast chicken over. Like those things to prepare for both a personal disaster and then also, prepare for You know, a lot of people might have some food in their earthquake kits, right? So thinking for natural disaster too. And I want to kind of highlight back on that meal chain concept. Again, that is a community-based idea that we implement because that's not something our society provides for us. A lot of prevention is adding those things that society does not provide for us, or for getting what is already being used in the community and expanding it. So now in my congregation, it is now a system. Whenever someone is sick, has a death, any of things like that, there is a point person, there's a sign up. It's no longer hodgepodge because we got better at doing it. And that really helps families in those times. So I'm going to talk a little bit about our own individual organizations. So a few things that I want to bring up. One is, for anyone who's had to work with Cal OES knows that we cannot use Cal OES funds to pay for food. That is a major barrier. A lot of us who run, you know, after school programs, the youth are hungry. We just talked about how much they need food, otherwise they can't learn. We talked about how they depend on after school snacks in these programs, and then we can't offer them food is really tough. It also helps with retention. So something that we've been doing is we've been trying to advocate for Cal OES to change that. I don't know when they are, but I feel like if we keep advocating enough for it, then it might happen one day. These are all steps that you can take or your organization can take. Partnerships. I'm going to highlight for a second News up in Napa. They do a great job about having local restaurants and community members donate food to different programs that they have. They have teal tacos for Sam with a local restaurant. They had orange desserts for Teen Day Months and Prevention Month for another restaurant. I wish I had some photos. I do have them somewhere actually in my files. I should have thought to put that up on a slide. And there are other organizations I know that do this. But again, community strengths is something that folks can do to, okay, we can't use our funds to pay for food, but hey, we do have snacks provided by X community member, right? That sounded weird. That sounded like excommunication. I meant like X as an example. For example, this community member. Another thing that we've talked about a couple of times in some of these prevention webinars is we are part of this equation, right? A lot of people are in this work because we are survivors or we have personal experiences, and we always talk about bettering the lives of survivors, but we also need to be able to do the work ourselves, right? And something that took a while, but what we now do at the partnership is we give per diems in advance when someone's going to travel, which is huge, because before that was a lot that folks had to take and put on their credit cards in order to be able to travel for work. And sometimes you don't really get a choice of when you travel. And it is really exciting, to be at to be a policy advocacy day, for example, to be at Building Change Together when we host one in person. But that's hard. I have before been in a car where we've all gone to Target and bought groceries, to put in our room, because that's easier than eating out all the time. But that's tough. Because sometimes you get a fridge that's this big, you can't exactly like cook things in there. So that is something that we recently started doing, is per diems in advance. And that is something that we've been trying to get other organizations to do as well. So that's something that you can do on your level too. Any other thoughts about how your own organizations can tackle food insecurity, or are your organizations already doing some things around food insecurity? Heard from Erica about another partner that they have, that their agency works with. Anyone else want to share? Our homeless shelter also makes food boxes for clients, but also staff. Wonderful. I'll also kind of say a note too is, there's so much that this is connected to. And every time, as I keep going through each slide, I think more things I want to say. Because the stuff is also really medically related too. Think about how expensive gluten-free products are. I have a couple of friends with celiac. It is really hard. And that is also something that we've done with the partnership too, is when we go to like for example, for Orange Day, we went to a restaurant after to celebrate. We made sure that there was a gluten-free menu because we had someone with celiac disease. So being mindful of those things. If you're going to we provide food at our staff retreat, you also need to have gluten-free snacks. If you don't have anyone that has celiac, or gluten-free needs, I'm not saying that, but being mindful of people's dietary restrictions and think about how much harder that is in our prevention work if there are people with diabetes, celiac, anything that would create some sort of food restriction, right? Culturally, that is a thing too. If something is to be kosher or halal, that's really tough too. And where does that put certain folks? And that's really, when we think about our marginalized populations, if we're marginalizing them in our prevention intervention work as well, that's also not helpful. Okay. So I've talked about advocacy a bit. Policy advocacy is something that can always be done. There are always things that we need from the government. Oh, of course. Thank you for being here, Jonathan. So, I'm gonna wait, why is it not going? Okay. I'm going to put in the chat, there was an organization that I don't really think exists anymore, but they still have their bills up from last year. And they divide them into school-based SNAP-related root causes in early childhood. And so school-based, this is talking about, increased funding for school meal programs. Another thing that we've heard about is like when you think about your local community, how many people in the local community have school lunch debt? Like, what is that? No child should be, told they can't have food because they're in debt at school. So there could be things, check in with your local school district, see what the policy is around that. See if there is a way that you can enact it so that that doesn't hold a student back from being able to eat lunch at school. So SNAP, we talked about how that's CalFresh. But there have been a couple of acts to, for example, modify some of the work eligibility requirements. We know work eligibility is really hard, because you're already doing so many hours and you're trying to prove, but you also might have caregiving duties and they really are harmful work requirements. There are some, there's a bill about allowing households with children with who are chronically ill or have medical conditions, to deduct allowable medical expenses. Especially we're seeing an increase of that too with COVID and long COVID, right? So there are a lot of families that maybe don't meet the definition of someone who is disabled in the eyes of the government and receives SSI and therefore can have SNAP, but their medical expenses are huge. An unexpected trip to the emergency room is huge. Seeing a specialist is huge. These are all things that are highly related. Root causes. So if anyone remembers the child tax credits, so restoring that would be something that would really help. That helped eliminate poverty by 50% in this country when it was happening. Stuff around housing, like expanding housing vouchers, that is also another root cause that can lead to food stability, right? Because we talked about food safety. If you are homeless, you do not have a fridge to put food in. That does not work. And also because we're now unfortunately criminalizing homelessness in this country. And then early childhood. So there's a lot around, that can be done around daycare centers, Head Start, to increase reimbursement percentages for their meals. Kind of like how doctors can be reimbursed with Medicaid or Medicare, there is kind of that concept as well, for meals, like for example, Head Start, who are at risk, children are able to access, child care programs. So adding even an extra 10 cents of reimbursement to eligible meals and snacks better incentivizes those facilities and also helps what they're able to do. So here are some examples of things that you can look into in your community or that you can advocate for on a larger level, that hopefully, will help decrease the levels of food insecurity. So we're getting close to the end. We got like a little over 15 minutes left. So I want to take some time to say, what's resonating for you? What other things can I help look up for you? Like maybe I didn't, hey, it was great that you told me about this, but I really want to know about these other things too. What else can I do? And, do you have any ideas? Like what are things that, you want to embark on, or maybe that your organization or community can do? That's okay if you need to kind of, percolate on it a little bit. I've been giving you a lot of information.
Does your organization have like a cheat sheet for like actionable steps that you'd recommend or resources for that?
That's a great question. Not per se. Kind of creating this webinar in a way is how we wanted to kind of bring this together. I did include the paid family leave toolkits that we have. We also have a lot with housing in our policy department, and you can also, I'm going to put in the chat too, our policy department has a bill tracker, which goes through the bills that are up for 2024 in the California legislature, and says whether we support it, whether, and like what its status is, if it's passed, if it's not. So we have kind of things scattered throughout, but that's a really good idea to put something fully together. This recording and all the links that I've shared will be in our resource library, which is on our webpage. So it will be accessed there. But otherwise, I kind of just designed this program myself for today. So, but thank you. In future, I will think about putting together cheat sheets. I don't have another slide. I'm going to take away the PowerPoint for a minute. I also want to share with some of the other things that we have coming up. As I mentioned, we have our call on natural disasters tomorrow. It's going to be at 10 a.m. When you register for Zoom, some of you might already be on it because the Prevention Peer Network calls will be for every month, but the topic changes. So if you aren't already on it, or you might already see it in your calendar, there you go. We also, for things to sign up for, we have our Prevention Peer Network, which is to get our monthly newsletter, and our peer learning circles. Our peer learning circles, our next one is going to be tomorrow as well for Safer School Communities. We're having a guest speaker Mia from SAVE to talk about hosting events and engaging youth. We are also bringing back, you might have seen it come through if you're also on the Valor newsletters, but we are hosting our economic justice peer learning circles with them again. So that is also something to keep in mind. That will be, the first one will be August 7th at 10. And then there will be one in October and one in December as well. So those are some things that we have coming up as teasers for August. As well, we have our annual planning for DVAM with our communications team. That will be August 15th. I do not have the registration for that yet. Actually, no, because I already mentioned the economic justice peer learning circles. I'm also going to put my email in the chat if anyone wants to contact me at any time for your prevention needs. Is there anything else that folks want to share? We have about 10 minutes. If not, it's also really fine for if we wrap up early. I know today was a little bit more like data and information as opposed to discussion format because this was a webinar. But I really appreciate those of you who have contributed. And for those of you that have just been listening too, I hope that you take something away with this. All right, I'm going to stop recording. I will stay on though. Oh, thank you as well. I'm seeing some thank yous in the chat.
Thank you.